Hello and a warm welcome to the programme from me, David Foster. Now, who is going to discover a vaccine first? And with that, get the bragging rights and the profits that will undoubtedly go with such a discovery. And will everybody benefit? That is far from a certainty, with international cooperation fragmented at best. In this roundtable, we'll look at how to get the world together to beat the virus. Well, is there a place for national pride in any of this, or should we be seeing a truly global response? In fact, is one at all possible?
In the war against COVID-19, dozens of laboratories around the world have become battlegrounds. Nation-states are in a race to find a vaccine. At stake are millions of lives and many billions of dollars. In a virtual summit convened by the EU, world leaders pledged nearly $8.3 billion to research COVID-19 vaccines. But the US didn't take part, and the Trump administration's lack of cooperation has alarmed global health officials. The fight is against the virus, but vaccine nationalism threatens the drive for international agreement and cooperation. Concerns are only deepening as President Trump squabbles with China and the WHO over the origins of the disease. As powerful countries pledge billions, this brings into question whether developing countries will have the same access to a vaccine. Philanthropist Melinda Gates has warned the worst situation would be if, when these tools are available, they go to the highest bidder. That would be terrible for the world. COVID-19 anywhere is COVID-19 everywhere, and that's why it's got to take global cooperation. Will the self-interest of countries and corporations disrupt the joint effort to find a solution to coronavirus?
Well, we're going to be hearing about this from a number of different angles. In a while, we'll hear from Inderjeet Palmer, Professor of International Relations at City University in London, and Heidi Chow from the campaign group Global Justice Now. First, though, let us say hello to Mario Ottiglio in Geneva, Global Health Consultant, and in Nairobi, Dr. Amit Thaka, Chair of the Africa Healthcare Federation. Mario, let me come to you first. You used to work for a group called the International Federation of Pharmaceutical Manufacturers and Associations. You know about Big Pharma, and its boss recently said, look, people shouldn't be taking advantage. This is David Ricks. I agree 100%. That would be unethical, but investors give us capital and expect a return. They are going to put, in your experience, would you say, profit before people?
Well, I don't think that this pandemic, honestly, will lead into a global conversation about the profits, especially in this case. That is what we are seeing from any sector of society. It's quite a dramatic effort on an accelerated pathway, if you want, to develop solutions, treatments, vaccines in this case. And you know, this has been possible because the industry has quite a long track record of developing solutions to combat infectious diseases. We have seen, you know, in the past, like MERS and SARS, and actually what happened with the SARS. It's quite an interesting story where industry in that case was willing and able to take the risk, but then they had to stop their endeavors and write off the cost because SARS disappeared and there were no longer any patients to help. But then you can argue.
If I could just interrupt for a second, what I'm saying to you is you would not expect a leopard to change its spots. Perhaps they are going to be putting profits before people.
I haven't said that. I think there are several solutions that you know can be taken really to mediate the two tensions, if you want, right, between public health and also you know the right for company to have returns. There has been in the past already a couple of solutions that have been put in place. For instance, advanced purchase commitment, advanced market commitments, where you know donors step in and kind of try to pull in funding to actually create a market for the purchase of those vaccines or treatment in this case. So you're talking about R&D subsidies, you're talking about outright purchase of vaccines rights by governments, philanthropists, multilateral organizations. And so you can preserve the incentive for innovation, but also give the purchaser the freedom to set the price of the vaccine. For instance,
okay, can I go to Amit for a moment, Mario, on this one? I mean, with your remit looking at health across the continent of Africa, do you think pharmaceutical organizations are going to be looking and thinking we must provide any vaccine we get for as little profit as possible? We must make it as affordable as we possibly can. What do you think they will do?
It's going to be a very tricky question, and I think there'll be few people who will be stand up to be counted, few companies that will probably drain in anything that they have as savings or anything that they have as costs and will provide this. But there will be quite a few who might say, at least cover my costs, at least make some kind of a margin. And there'll be some opportunists that I think will be cited after COVID is over as the boys who played the cowboy game. And I think those are the ones that we as the world need to start shunning. There'll be multinationals who will play the wrong game. There will be local distributors who will play the wrong game. And I think we should keep a scorecard. And this scorecard will be the one that we will tick, because this is not the end. This is not the last pandemic or a situation of emergency.
I'm wondering who's going to hold them to account. The World Health Organization, for example. Let me just quote from Richard Horton, editor of Lancet, the medical magazine. He said of the WHO, it's been drained of power and resources. Its coordinating authority and capacity are weak. Its ability to direct an international response to a life-threatening epidemic is non-existent. So is the WHO going to hold the feet of big pharma and national governments to the fire and say, people out there must have it, they must have it quickly as soon as it's available, and they must have it cheaply? Do you think so?
You don't have a principal or a prefect in charge of the health of this world, first of all. For anybody out there who is a global health leader and they think there's one institution responsible, they're wrong. This pandemic has shown health is a responsibility of every leader, every president, every country, every institution, and it's not going to change for many years to come. So pointing fingers as WHO is also weak from the person who wrote it. I feel that WHO has probably tried what they have. They are no means perfect. What we need to be is part of the solution and not part of the problem. I think that quotation is misplaced, misinformed, and probably needs to be corrected.
Okay, Mario, what do you make of international leadership in this?
Let me start with a quote. I read something very nice in Financial Times where they were saying that coronavirus may be a great leveler, but it's certainly no equalizer. And I think this is like spot on. I think if we don't think globally, that in my view will make a big mistake. And that is, like in terms of the approach that we need, right? This is like an unprecedented situation. I don't think anybody in our generation has ever faced something like that. And we need like a one-team approach. And this involves the pharmaceutical industry, but also the governments, also different multilateral agencies. There are so many aspects to look into, right? There is a blueprint that needs to be developed for addressing issues of financing, of global productions, of movement of goods, right? Look at all the trade barriers, for instance. There is production, dispensation, adherence, equitable access. There are so many things that we need to figure out once we will have some solution.
Who is going to make sure that there is some kind of leadership? What form would that leadership take to get the equitable distribution, costs, etc., and the researching of the vaccine available to the entire global population? Who?
I can give you my take. I mean, first of all, we have seen already some sort of movement, right? There was a recently launched European Commission-backed access to COVID tools. It's called ACT Accelerator. And it's a quite step in the right direction because it's an initiative that devoted to develop rapidly and equitably vaccines and also deploy therapeutics, diagnostics, whatever is needed. There are global bodies that are existing. For instance, the CEPI, it's the Coalition for Epidemic Preparedness and Innovations, and also Gavi. They are working already on vaccines and worldwide access to them. So, for instance, if we are going to channel some of the efforts, could make sense that actually we try to boost funding for these entities so that we can ensure that products reach the most disadvantaged, because that's I think, what's going to be critical here.
Ahmed, your organisation covering healthcare across Africa, is it in touch with those who stand to make big profits from this? Is it in touch with rich Western countries to say, we'd like your help and we don't want to have to pay for your help? And if so, what sort of response have you been getting?
So that's a very good question. And we've been in touch with several foundations in several countries. We set up the first Africa Public Health Foundation last year at the World Economic Forum for the same reason that you've been bringing up on this show. And that's holding leaders accountable and having Africa to become self-sufficient. The leadership of Africa CDC and Africa Union has been sterling in the last few years, and I think we might shine. So we've been in touch with, say, the Gates Foundation, the Rockefeller Foundation, the World Bank, the G7, and I think the response has been fairly positive. And I think there's been equal distribution of donations that come, like the Jack Ma Foundation. We received so many kits in Addis, and they were equally distributed to the African countries. So we are actually showing the spirit of solidarity and the spirit of togetherness when it comes to fighting the COVID-19 pandemic in Africa. I hope we can sustain it and we can rebound in our economy quickly.
Mario, tell me a little bit about the Global Vaccine Alliance and how this might fit into ending the political infighting that we are probably already seeing and certainly may see more of.
Yeah, I've mentioned them as I think they've shown in the past to really be a global leader and to be able to provide a coordinated response. I remember, for instance, some of the case of the pneumococcal vaccine and the access in low and middle income countries, where actually the World Bank and Gavi helped design and launch the a 1.5 billion pilot to advance one of those advanced market commitments that I was discussing before. I think whoever it is going to be very important that actually there is some global response, because we have seen already a lot of statements, right, when it comes from some of the country leaders that the doctors, the scientists, the community is talking about finding a global vaccine, but then national leaders are emphasizing that immunizing their own population first. It's very important, like in the US, in China, or in India. So I think to avoid that and to avoid what happened in 2009 with the swine flu, I think a global answer is needed, and Gavi or other bodies are definitely fit for purpose.
There's a guy called Gerald Posner. Let me come to you, Ahmed, as we wrap up this section of the program. He wrote a book called Pharma Greed, Lies and the Poisoning of America. He says they're all in this race. That's the big pharmaceutical companies. It'll potentially be a blockbuster for the industry in terms of sales and profits. The worse the pandemic gets, the higher their eventual profit. Where's, as you referred to in your last answer, the spirit of cooperation in that statement?
I think what you're talking about is, when I meant the spirit of cooperation, I feel I meant the global leaders, people who are looking at the bigger picture. But now I think you brought in the pharma side, where you brought in the greed and the profit and the mucky stories we hear about the pharma. I don't think we've actually exited that. The pharmaceutical industry is going to be tested again in this pandemic. If you remember the HIV/AIDS situation, and you remember Ebola, I can't even name a single pharmaceutical company that you can say could be counted as coming out of its shell to help the world. Many of the pharmaceutical companies kept guarding their share prices, kept looking at its supply chain. And I think we need to look and reposition pharmaceutical companies around the world and ask them to rethink what their value offering is in the global health. It's not about pushing the numbers of vaccines or pushing the pills. It's now refocusing on the value of health. They have a lot.
I'm going to have to say, Amit, I'm going to have to say thank you at that point. Thank you very much indeed. Also to Mario Ottiglio, we appreciate your time, the time you've given us coming on this program. And we should remember, of course, that you mentioned AIDS. Amit, there is still no vaccine for that. We appreciate your time. Thank you very much indeed.
Thank you.
Thank you.